Welcome to the Rejuvaness Podcast. I'm Dr. Rosie Roeder.
And I'm Andrea Sparr.
And today we're going to talk about a condition that affects 5% of the population, but a lot of people don't talk about it openly, and that's hyperhidrosis.
Or excessive sweating.
Yes.
So definitely there's two different types on the market. A lot of people are like, everybody sweats. Why are you complaining? Okay. Hyperhidrosis is an overabundance of sweat. People sweat more than the normal person. They sweat in their hands, their scalp, their feet. They're changing clothes multiple times a day. And these people get so embarrassed that they can't even leave their house, go to company events. So it can definitely be life altering.
And we're not talking just about situations in which there's some anxiety, like you're going to an interview or you're going on a first date, right? This is just normal day-to-day activities, and they have stains under their armpits, right?
Yep, and it's chronic, and they can't even keep their pen in their hand that their hands are sweating so much.
I do know some people that come to me for one of the treatments you're going to describe for that, but I don't see it as often as the dermatologists see them. So we're going to start by kind of going through the basics. What is hyperhidrosis? You did a small introduction of that, but biologically where it starts, and then we'll guide you through the treatment from the most basic to the most invasive.
So any sweat that your body produces anyway is more for like temperature regulation, and people that overproduce sweat, they're kind of outside that realm of it's just helping the temperature on the body. Hyperhidrosis has two different types. There's primary and secondary, and primary can happen for no rhyme or reason. Okay, people can just have excessive sweating, whether they're nervous, whether they're just waking up from their sleep, working out. There's no rhyme or reason. And then secondary hyperhidrosis, there's some medical term or medication or medical condition or medication that's behind it that is causing you to produce excess sweat. So there's some antipsychotic meds that can cause it. There's some other over-the-counter like products that people use that irritate the skin where the skin's trying to sweat as much. Thyroid disease, diabetes, and even a tumor in the brain can actually cause you to oversweat.
Wow. And some of those you can't avoid, right?
Right.
You have to take that medication. So now we have to deal with the secondary effects of it. But is the treatment any different?
Not really. I mean, again, so the baseline treatment for both of them would be to use an antiperspirant, and the best time to use that is at night. A lot of people don't understand why you have to put your antiperspirant on at night when you're out and about during the day and you're sweating. But your sweat glands are actually the least reactive when you're sleeping, you're not moving, and your body's at a calm state. So when you add that in, and most antiperspirants have an ingredient called aluminum salt, basically, and what that does is it combines with the actual sweat that's coming out, and it causes a little blocker plug in the actual sweat glands, and it slows the amount of sweat that comes out. Antiperspirants are best used morning and night, and there's several over the counter, and I even have one here today from a brand that I always recommend to my patients if they just want to try something over the counter called My Carpe. And this is a great company because the people that actually invented this company got tired of the over the counter products not working, and so they created their own brand.
So this is over the counter?
This is over the counter.
Can I look at it?
Yeah.
Okay.
They make many ingredients or many products that actually have like lotions for your hands, thigh lotions, boob sweat lotions, scalp. What? They have a whole night conditioning treatment where it's got a roller and pads and stuff like that. And then they make scented and unscented actual antiperspirants that you can use. And again, it'll explain on the front that it is best used morning and night. So you go to sleep, put it on, wake up in the morning, you can shower, you reapply before you go about your business. And they're really good products. I actually used their thigh sweat lotion when we went to Asheville last summer, and it was just hot and sweaty out there, and it dries pretty quick.
And you know how I love smells, and it smells really good.
That one's really good. And like I said, this is a good company because they'll actually even send us at the office samples for patients. They even make wipes that you can keep in your hand, in your bag too, if you need them, if you're sweating more. Okay.
Cool. And I have teenage boys.
Yep.
So you know I'm going to be getting some of these for them.
Once you kind of max out on these and you need a prescription antiperspirant, you're looking at something like Drysol, which is an aluminum chloride, and that also does the exact same thing, but at a prescription strength base where it's actually mixing in the compound and causing those pores to be clogged, so it slows. That you kind of have to get in a mood where you're using it 2 to 3 times at night to begin with to slow the sweat down, and it's all about the maintenance. I tell everybody for everything that you use for dermatologic conditions, it's going to be all about the maintenance. Yes. I need a shirt that says that because I literally say that for everything, but it's true. If you get in a good maintenance routine, you're limiting yourself the exposure of having more chronic breakthroughs, having more sweat coming through, and you needing products every single day. And some of these products you can't use every single day. So Drysol in general, which is aluminum chloride. You put it on 2 to 3 nights in a row or until you stop sweating, so anhydrosis, and then weekly, a couple of nights a week after that as a maintenance mode. Okay. Other over-the-counter products that are like this have the same ingredients but at lesser strength. So if you've already tried 1 or 2 antiperspirants over the counter, I always recommend seeing a dermatologist just so you can start on something that's still stronger that you may not have to use as much before things can get worse. Okay. Most sweating occurs young and adolescent years. So most of these people that I see are in their 50s, they've been dealing with this their entire life, and they're like, I've tried everything over the counter on the market. I've even tried dry sol from my primary care, because I think that's the most thing that they will write before they refer to us. And so there's other things on the market. So like glycopyrronium or glycopyranate wipes. They're called Cubrexa. They're wipes that you can use every day. Use one wipe for both armpits. They're only FDA approved for the armpits though. So people that have hand sweat and foot sweat, you're still going to have to look more at the over-the-counter products and the dry sol. There's glycopyranate pills, so the anticholinergic effects from the pill, though, dry out the entire body.
Yes,
and not
dry
just
mouth, the cotton mouth, people don't like that.
And not just the armpit area, and that can actually cause long-term problems. Even though, like, I've even researched for some patients that have come to me that have been on glycopyranate oral for years, there's no long-term studies to show what that anticholinergic effect is going to cause on you long-term. So I try and tell people, let's try and add something else, maybe taper down, because some people even take it 3 times a day, and that's just really, really drying them out.
So this is my sweat version of, I'm going to say, using a product like this for small indications or event stuff. So I have used the Cubrexa wipes the night before I was going to go to an event where I'm wearing a strapless dress so I don't sweat the next night. It's a good or bad thing?
I mean, as long as you're really washing your hands and stuff after using it here and there, I don't suspect that it'll be a problem. There's a lot of people that use it for off-label use, but getting that product, if you're trying to use it on like your forehead sweat or your face sweat and you get it in your eyes, it definitely can cause blindness and have some major consequences. So you have to be very careful about how you're using them. And when you see a dermatologist, they'll say, this is how it's FDA approved. If you choose to do this, that's you, boo, because it's not, I explained how to use it, basically, you know? Can't go home and make them use it properly. But people like to experiment, but
this one-off use,
I don't think is right.
After,
if they feel like they needed it, it definitely may have helped. Okay. There's a new one on the market that just came out this past year called Sofdra or Sofdra, and it is basically the same thing and does the same thing as dry sol, except you use it every single night. So it comes in a little pump, and it even has an applicator on the tip of it. So you take the cap off, put the pump on the cap, put the cap back on, and use it as a deodorant to put on at night before you go to bed. So again, multiple products that can be over the counter, multiple products that can be prescription strength, but then you're moving into bigger things after that, like Botox injections. Now, have you ever done that for any of your patients?
Yes, I've done a lot of Botox injections, and that's what I get the most is people that want to come in for Botox. So since I do Botox, I have done that since my residency training, but it's a lot of units.
It's a lot of units. It's 200 units.
Yeah.
And some of these patients' insurance will not cover it, even if they've done failed everything else on the market.
Correct.
So it's kind of hard to get covered, and it can be very expensive if you try and pay out of pocket, but it works well, and you get results for about 3 to 4 months. Some people only go twice a year because some people have gotten it so much it's slowed down enough for them to be able to maintain with that in combination of antiperspirants, and they may only get it every 6 months. But it's only FDA approved for the armpits, but I have seen it injected in the hands as well.
Yeah. I think if you're going to do palm injections, you just got to be careful. A lot of the structures in the hand. Volume can even lead to a partial compartment syndrome. You got to make sure you're aware of nerves, tendons, and things like that, so you don't put it in the wrong space. So make sure you go to somebody who actually knows what they're doing. I've done it a lot for armpits. It's just my view.
Right.
And I may be wrong. But I do think that for people who have a medical condition, that we should have a package pricing for hyperhidrosis Botox instead of just charging them strictly by the unit like we do for cosmetic purposes.
Yeah, because that's a lot of units, like you said.
It is.
And that really will break the bank.
I mean, you're really using a whole vial per armpit. So, and the good thing, though, is that unlike cosmetic like Botox or any other the neurotoxins, it lasts longer.
Yes.
So you do have that benefit.
And I tell everybody, you still may need your antiperspirants here and there. Now, it's not going to change long term, the hair follicle situation. having to shave under your armpits if you choose to shave, the hair growth, but it definitely can help slow the sweat. So you may not have to do as much in that area because a lot of people are like, I just had to shave my arms because I sweat so much and it sits on the hair. So next couple of things that are on the market, we don't have them in our practice, but there are some local practices that have one of them. The other one, I really haven't seen that posted anywhere. So the next thing would be a procedure called MiraDry, and I call it microwaving. So they're basically microwaving your oil glands, and that helps either stop, slow, or limit the amount of sweat that's actually coming out during those times, and it damages it so much it can be more of a semi-permanent fix.
A lot of my plastic surgery friends have this at their practice and swear by it. And I think it's an awesome alternative to have to just laser hair removal plus Botox and all of that. So, you know, some people with time will fail one or more of these and they want a more permanent solution. So, like I said, there's other places around Charlotte that might have MiraDry in case you've boxed all the other things out or you want a different solution.
Yep. And then iontophoresis, big words today. Iontophoresis. So that is where we use electricity or an electrical current, and the patient actually it's more for hands and feet. So they actually soak their hands in a solution that has anticholinergic medicines in them, or normal saline. Some people just use regular tap water, but when you soak it and you set an electrical current through it, it actually makes the ions connect, and that can actually push the medicines in. It can slow the sweat that's coming out if you're using any of the anticholinergic medicines. I've even read that it has benefits with the use of Botox together, and people usually see results in about 3 to 4 weeks because they're doing it 1 to 3 times a week, and then they go into maintenance mode where it's just weekly, but that also requires maintenance. So if you stop, it's going to come back. It only slows. It's not a permanent solution. The MiraDry plus an actual surgery that we're going to talk about is going to be the most close permanent solution that you can get with hyperhidrosis.
Yeah, I think almost everything in what we do is additive. You can't just give up the first line. The first line is going to be the basis to which you build things, forward.
And you always got to, especially with insurances, because if you don't follow their algorithm, your patient will never get the medicine that they need.
Yeah, it's very important to follow the algorithm. It is very frustrating because people will listen to something like this and be like, hey, I want to go to do the MiraDry and I want my insurance to pay for it.
Right.
And that's not how it works. It's like you got to take the baby steps. You got to crawl before you walk.
Right.
When it comes to playing the insurance game.
And the last thing is going to be surgery. So a sympathectomy is basically you're going to cut it off at the head. All right. Whatever's causing the production of it, you're just going to snip it. But that can be a hard recovery. It has big surgical risk. But some people think it's worth it. If their life has been ultimately destroyed by sweating so much and having to keep shirts on hand and having to keep socks on hands, that may be an option for them. But at our practice, like I said, we're small mom and pop here in North Carolina. We don't offer that type of procedure.
Yeah, I mean, it's something you would expect if you're doing the endoscopic thoracic approach, a thoracic surgeon to do that. Plastic surgeons are trained to do sympathectomies of the hand for other conditions like complex regional pain syndromes and things like that. But I don't think most of us at this point in our career are really doing that kind of detailed things. I would go to an academic center where there's specialist hand surgeons that do this and look for someone who does this on a regular basis. I always say when you go to a surgical approach, you want to go to somebody that does this procedure routinely.
Yes.
And by that, I mean weekly.
And
I mean, there are things I do daily, but something like this might be a little bit more complex, right? But you're going to get better care for patients if you're a patient by having a surgeon that does hundreds of these a year.
And I mean, and you are your own best advocate when it comes to these things. Do not be afraid to ask these questions. How often do you do these surgeries? What's your success rate? What was the worst thing that you've seen that had happened to somebody? These surgeons are prepared for that. A lot of them do not take offense to these questions. They want you to ask these questions because they want to know that you're a right fit for them and they're a right fit for you.
Right. Because I always tell my patients that even if the complication happens 1 or 2% of the time, if it happens to you, it happens 100% of the time.
Right.
Right? So it's rare, and people kind of want to hold on to 98% of the time it goes well. That's correct. But if you're a part of the 1 or 2%, that kind of sucks.
And that's kind of where it gets turned around on, well, it's the provider's fault.
Yeah.
Because it was a side effect that was discussed,
Right.
And it was like, no, it wasn't. I mean, this is something you signed up for. This could potentially happen, and you are unfortunately in that 1%. And a lot of people just don't believe that they can fall in that 1 and 2%.
I'm going to ask you something controversial that you may or may not be prepared to answer, but I'm going to ask you anyways. So when we talk about deodorants,
right,
and antiperspirants and the effects of aluminum in your deodorant or all other chemicals.
We're going to talk about cancer.
Yes. We're going to talk about cancer.
So perfect. I got you on this one too, because studies were kind of trying to get people to show or say that products like aluminum can cause Alzheimer's, that they can cause cancer, and there is no study that shows that. Okay, even if you go on to the Cancer Society website or the Alzheimer's Association, there's no link that they can put together for aluminum and Alzheimer's, and then aluminum and then actual cancer. Well, specifically breast cancer.
Yeah, specifically breast cancer, because I have a lot of breast cancer patients, and the first thing they do is try to drop their deodorant to think that this is somehow going to now help in any way, shape,
and it
or
gets
form.
Worse.
Yeah, and it's okay.
Right.
Yeah.
And like I said, and I guarantee there's still studies going on, but there's nothing that they've been able to find that can link both of those products.
Well, unfortunately, I feel like we're in the age of pseudoscience.
Yes.
Right? Where like things are half-truths are portrayed out there. And when there's not enough evidence, it's like it's bad, right? But we're, as people who advocate for science and for factual-based care, like we want to adhere to what we know. And if we don't know, we tell you, like, we don't know, right? We are considered the patient whole. Just because we adhere to science doesn't mean we're just trying to sell you on something, right? Meaning a treatment or a product without understanding the consequences to your whole being. So it's okay to wear your deodorant.
Yes, it is.
And if you choose not to wear it, it's okay too.
Right.
But, we don't know any studies that find that there's a link.
And if people use these antiperspirants or like the dry saw and they still feel like they're still getting an odor, I always recommend adding a benzoyl peroxide wash in. Benzoyl peroxide is an antimicrobial, so it actually takes down the bacteria that's on the skin and the sweat. And so when it's coming out, it's blocking it. So it actually helps with odor under the armpits as well. So just a small change in that situation. If you decide you don't want to wear specific deodorants and you just want to use the dry saw, because it's usually a liquid that just gets wiped on and it dries pretty quickly, you can always add in some extra things topically like a benzoyl peroxide wash to help fight odor if that's your next concern.
Yeah. And I'm Brazilian, so we shower like 2 or 3 times a day. There's nothing wrong with Dial or Dove soap too, as the beginning part
a lot of people
of this process,
like,
and just good hygiene.
Like the native deodorants and stuff that are all natural, and you can still smell like bacteria and stuff coming through, and they're still not blocking the pores. So people will continue to change stuff. There will always be new things on the market. So if you or somebody has been experiencing this, it may be time to reach out to your dermatologist to see if there's something that small change that they can add in to even minimize the shame or the resentment that they have of going out to job stuff, because they're like, I got to change 47 times before I even get there.
Right.
So it's just one of those things. It's always nice to have a conversation, whether you choose to do any treatment through the provider that is prescribed, that's fine. But it's always nice to get more information, because like I said, the information about it causing cancer is the same thing as when you were a kid and you were picking at a mole and your mom's like, if you keep picking at that, it's going to turn into cancer.
Right.
It only took one person to say it.
Right.
And it's just wildfire after that.
Right. And we just got to keep to what is factual.
Right.
And also, again, hyperhidrosis is not an uncommon, condition, but 5% of the population is
that's a lot of population.
That's a lot.
Yeah.
And it's very psychologically distressing to the people that have it. And it's not just that you're sweating because it's 90 degrees outside.
It is life-altering for these people. It is really
life-altering. And we have really great approaches, like Andrea said, topical, oral, procedural in terms of injections and other different types of approaches to quiet down those sweat glands.
And I have people that come in, they're like, hey, I've been through all this, I'll let you maybe try one thing, but do you do the MiraDry here? And I'm like, no, but I can tell you where to go. Like, I will point you in the right direction. I'll get you to where you need to be if you want to try something that we don't offer. But like I said, it just takes you coming in and talking for you to get all the information.
Okay. Yeah, great. Well, I think I learned a lot. And I'm not going to use my Vanity Cube Reza anymore, though. I'm just going to go to, like, carb.
Yeah, Micropay is fabulous. You can go on their website. Like I said, they've sent me a bunch of samples, so I usually give my patients a 20% off coupon because they're pretty good about that as well. They just want to help people, and that's another good thing about them. But they actually are sold at Target now, so definitely don't have to go online to buy it.
Great. All right. right. Well, I hope you guys learned a lot about hyperhidrosis, the condition about excessive sweating that about 5% of the population has, and with great alternatives
Most
for treatment.
of them probably live here in the South because it's supposed to be 101 today. I tell everybody we're sweating butter at this point.
I'm Dr. Rosie Roeder.
And I'm Andrea Sparr.
And we're the Rejuvaness Podcast. We'll catch you next time.
And don't forget to like, comment, and share below.